Cool, thank you very much for the opportunity to speak today. Thanks to the committee. I'm going to just tell you a little bit about a story, really. I suppose it's a personal story that I think will probably resonate with some of you. It's a story, my story, an epiphany of sorts. I had an epiphany too, of sorts. And what I tried to make of that epiphany by way of principles and examples, and I'm going to just go briefly through that. That's a picture of a guy called Bill Reed. Some of you will know him. He's a regenerative practitioner, and he's based in Boston, in Massachusetts, and has a business called regeneration.com, and they have offices in Santa Fe on the other side of the United States. We started our carbon journey at Counties Manukau in 2011, actually, and we joined the CMAR scheme in 2012. And, we were reducing carbon for all the reasons, the simple and straightforward reasons to reduce carbon, the straightforward black and white health reasons and the common sense of it, without really, I think, actually totally grasping the opportunity that gave us to live better. And it was at a session at the Gus Fisher Gallery in Auckland, actually on Shortland Street. I don't know if you know it, but there was a public meeting there, well, a small meeting that was hosted by Jasmax, the Auckland City Council, and Resine Paints, amongst others. And strangely enough, I went, and I could easily have not gone. You could just so easily have not gone. But I went, and it changed me in a way, because I had an epiphany. And it wasn't a religious epiphany, I didn't see God, it wasn't one of those. It was something different, actually. It was the kind of thing that happens when you get a framework for something that you know is intuitively true and right. And I had that experience listening to Bill and talking to him afterwards, and we've been friends and in contact ever since. And I'll just quickly tell you the story that he told. I'll do it fast. I'll have to do it fast. He was talking about a job that he had. He was asked to go and look at some land, really big, expansive land under the Teton Mountains in Wyoming. Beautiful there in Wyoming. But the land was sort of been run down for maybe 100 years or so, and it was kind of dead. And the guy who bought the land asked Bill, what are we going to do? How do we get this land back? And Bill actually, interestingly, did what a doctor does. That's one of the things that I kind of liked about his approach. So he took a history, he did some investigations, and he put up a treatment plan, which was kind of cool, And the land, interestingly, had been intensively farmed for generations. And he asked about the history of the land, and people thought that it was a bit more productive and greener beforehand. The Teton Mountains at that stage were kind of bare. So he saw this land, the land was rubbish, the Tetons were bare. And he asked about the land, he found out more and more information, he took aerial photographs, and he saw a groove running through the land, and he said, oh my God, I wonder if that was a river. And sure enough, the more and more people he spoke to, it was a river. And actually, the more and more people he spoke to, he got some records, and it turned out that land had a river running through it. It was green, and it was really, alive and dynamic. Salmon would swim up the river, and they would spawn in the foothills of the Teton Mountains. Bears would eat the salmon, and they would shit in the hills, and the hills were covered with trees. And Bill said to the guy, tell you what we're going to do. We're going to divert the river. We're going to wait for 3 years, and then you can work with the land and with the forces that exist there, the natural forces that exist in that place, and you can do what you need to do. But by recognizing the natural forces and working with them, you and the land will both be enhanced. And that's the story he told. And in a funny sort of a way, that was the kind of the root of the epiphany. And I've thought about, well, if I was to sort of dig into that story and try and figure out, what underpinned that epiphany, rather than just being a nice story, how would you sort of, tell that in a way to help other people? This is what I came up with, 3 principles, and I've been doing a bit of reading about this too. And so the principles really are those ones you see up on the board, and it's actually about seeing potential in a place or an opportunity. It's not just a place, And the moment is not just a time. It is an opportunity. And it is an opportunity to recognize the benefit that that place, time, person, interaction might have for the specific thing that you're engaged in. But it's also an opportunity for that to contribute to something bigger, to the regeneration of a larger system, or could be even to contribute to some sense of overall purpose, because in a funny sort of a way, it's purpose that drives and brings us together. The second principle is this issue of realizing potential as a source of higher order value. Now, that's kind of interesting because regenerative value is sort of created, can be created by each and every one of us, by teams and by organizations. And I think that when we listen to the talk that India gave this morning, in particular about the relationship that Māori have with their world, and when we talked about the opportunities that arose from that David spoke to, I think that these are examples of regenerative thinking, okay? So people are able to live better lives as a result of this and can contribute much more meaningfully to a kind of overall sense of collective well-being. You know, and actually when it comes to the environment around us, to improve the resilience and the health of that environment around us and of natural systems. So we're sort of working towards creating this kind of, it sort of speaks to the interdependentness of many things in a world where we tend to deal with these things in silos, you know, and it creates complications because it's messy, you know, and so, but this messiness is something for us to embrace, actually. It's not something for us to shy away from. And the third principle, I think, is about maintaining the kind of energy to keep these sorts of things going. And in a funny sort of way, I think about, you know, leadership skills, you know, or our role in the teams that we work with in our own organizations. And we think of, you know, David's anchor organizations, you know, and the roles that anchor organizations might play in actually, you know, help shaping society for the better. So, you know, and maintaining the energy for that, to actually create that energy and keep people going and keep people stimulated. Now, I've got to say, this work for me over the years that I've been doing it with the team at Counties Manukau and with this group of people in this room and on Zoom and in the remote hubs, I've got to say, of all the things that I've done in my career, it's been the most optimistic and uplifting work that I could have hoped for. And so it's that kind of energy that I think is kind of fabulous. This is one of Bill's slides, actually, and it's a kind of good slide. Because it talks a little bit about the journey that we're going from you know, thinking about design, from conventional on the left-hand side, which is sort of staying within the law. And that's where we've been in New Zealand for a long time. We still are. And if you were to think about the building code, for example, you know, that's where we are. And if you were to go to green design, well, it's just a slightly less negative impact. If you go to sustainable design, well, it's kind of, you know, status quo. You know, these are all sort of the design of technical systems, you know, and that's where David's efficiency comes in. But if we wanted to go out and up to renewable or regenerative thinking and development, we're getting into that interplay between human systems and the planet in a much more sort of interesting way, where 1 and 1 doesn't equal 2. 1 and 1 has the potential to make 10 or 20, you know, we're not quite sure where it's going to go, but it's got huge potential. So what we're talking about really here is the idea of, you know, functional ecosystems, recognizing them, understanding where the natural flows, where the power actually is, and blending that with social networks. In a funny sort of way, functional social networks are kind of ecosystems in themselves, but actually we exist within the broader ecosystem, you know. And what's really been interesting about Western civilization is how we've assumed this sort of dominance over, you know, planetary health, over the balanced ecosystems that have kept us alive and kept this planet healthy for so long, that we have assumed a sort of, arrogant and possibly ignorant dominance over it. And I think what we're learning slowly or quite quickly now is that can no longer continue. And we see that, of course, so these are not, new things. These are kind of old things. We're not discovering things that are new. We're rediscovering things that are actually have been with us for, been part of Indigenous culture for generations and generations. And Mason Jury's model of Te Whare Tapawhā is one of those one of those models of regenerative thinking, where, health and well-being is much greater than physical health and embodies a whole lot of different domains in complex and different ways. And this is the First Nations Health Authority view of health and wellness from British Columbia, where there are 4 big Native American tribes there that came together to form a view of health and wellness for their group in that great province of Canada. And they have a very similar multimodal view of health and wellness, but they describe a constituency of individuals, families, communities, their nation. And they also recognize that health and well-being contribute to a higher purpose, for their people to reach their potential, and this is regenerative thinking, and this is, thousands of years old. It's nothing new. So I want to just talk about some other examples, that dominate our lives here, value, which actually is defined as outcomes over costs or opportunity. But in the Western world, since Margaret Thatcher in the 1980s, it's been dumbed down to value for money, and it's been dumbed down even further to as much as we can get for as little as possible. And that's the nature of the moldy buildings at Middlemore Hospital. That's the nature of a number of employment agreements. That's what caused the trouble at Hutt Valley High School. These things, are a real problem for us. And what we really need to do is move away and redefine that value set in different terms to value the things that we have not valued traditionally in Western culture. And so for healthcare, perhaps it's about, or health and healthcare, it's about delivering maximum health gain with minimum financial costs while adding social and environmental value at every opportunity. And here we go. This is from the SDU, actually, or Francis Mortimer at the SDU. It's quite an old slide, but it's a goodie. And it was originally written up to describe the carbon footprint of the health system. And it's like a driver diagram for those of you who are familiar with those things. So the goal is on that far left-hand side of the screen, is to reduce carbon and improve health. And there are 2 major drivers there: to reduce activity and to reduce carbon intensity. And then there are the secondary drivers. But we all know that actually, even if we were to reduce, have totally renewable healthcare facilities, the healthcare system would have a considerably large carbon footprint because of the carbon costs of the life cycle carbon costs of all the things that we use, the medicines and the devices and all that kind of junk. So actually the only moral and ethical way that we can reduce the carbon footprint of healthcare is to do less. And the only way you can do that is to invest in prevention. And so this work is very closely related to the health and well-being agenda. Okay, it's about reducing preventable harm from alcohol, tobacco, and unhealthy food. It's about starting a riot. That's what it's about. And another one, quite quickly, is the Eat Lancet work that came, the Lancet Commission work that came out a while ago that linked the epidemic of climate change and malnutrition, obesity and malnutrition as a global syndemic with common drivers and common solutions. And that's another example of regenerative thinking, that you get double and treble duty actions. When you start to deal with the causes of one of these, you can start to impact the outcomes from both of them in a very positive way. And finally, my last slide is an admission. I now work for the transition unit in the DPMC and involved in this work about the New Zealand Health Charter. And this work is going to slowly roll out, and people will be talking a lot about it, and you'll hear about it as time goes by. It's really just in its very infancy now. But actually, this is an opportunity for us as a group of healthcare workers from all professions around the country to talk about who we are and what underpins, what values underpin our work. And I would say that this, what we're talking about today and tomorrow is going to have to be a very big part of that. And I look forward to those discussions with you. And that's the end. Thank you.